Hi, colleagues. I'm pleased to speak with you today about motivational interviewing and how we can apply it in the management of metabolic dysfunction-associated steatotic liver disease, or MASLD. As APPs, we know that lifestyle change is the cornerstone of MASLD management. Unfortunately, telling patients to lose weight or eat better, exercise more, rarely leads to meaningful change. Most of our patients already know what they should do, but that's not the issue. The issue is how to help them accomplish it. This is where motivational interviewing becomes essential, not just as a counseling technique, but as a clinical tool to improve outcomes in liver disease. Why motivational interviewing matters in MASLD? Well, let's start with the challenge. MASLD now affects up to 25 to 30% of adults globally. In the US, it is the leading cause of elevated liver enzymes and a growing contributor to cirrhosis and liver transplant. Yet we don't have a pharmacologic cure. Lifestyle modification, a 5 to 10% weight reduction through diet and physical activity, remains the most effective intervention. A 7% weight loss can reverse steatosis. 10% can regress fibrosis. But this requires sustained behavior change, which is where traditional advice often fails. Motivational interviewing helps bridge the gap. It allows us to meet patients where they are, explore their own reasons for change, and guide them towards action without resistance. Let's walk through how this works in practice. Motivational interviewing is grounded in 4 core principles. 1. Express empathy. Listen to the patient's experience without judgment. Number 2. Develop discrepancy. Help them see the gap between their current behavior and health goals. 3. Roll with resistance. Don't argue. Explore ambivalence. 4. Support self-efficacy. Reinforce their belief that they can change. A typical clinic interaction might start like this. APP. Your labs and imaging suggest fatty liver. What's your understanding of what that means for your health? Patient. I've been told it's because I'm overweight. I've tried diets before, it never lasts. Well, at this point, most of us feel the urge to jump in with the solution. But instead, motivational interviewing suggests we stay curious. For example, it sounds like you worked hard on this before, but haven't found something sustainable. Can we talk about what made those efforts hard? This opens the door for honest dialogue, and more importantly, patient-driven change talk. In MASLD, placing too much emphasis on weight loss can be counterproductive. Many patients equate failure to lose weight with failure overall. But we know that any improvement in diet quality or physical activity can reduce hepatic inflammation and reduce insulin resistance. And that's even without dramatic weight change. So instead of saying you need to lose 10% of your body weight, try what changes to your eating habits feel realistic right now? Or what types of movement could you add to your routine? I often find it helpful to ask, what's one small thing you feel ready to try this week? Something that moves you just 1% closer to your kind of health you want. It could be something like drinking only 1 can of soda this week instead of 3. Or use stairs to the office on 4th floor instead of using elevator at least twice this week. This takes the pressure off and builds confidence. Avoid prescribing strict plans. Instead, offer a menu of options. Mediterranean diet, time-restricted eating, brisk walking, strength training, and let the patient choose. Let me give you a quick real-world example. I saw a 41-year-old woman with metabolic syndrome and stage 2 fibrosis. She had failed multiple diets. Instead of talking macros, I asked, what's important to you right now? And she said, I want to avoid what happened to my father. He died of liver failure. So that was our opening. Over the next visit, she gradually reduced sugar drinks and started walking 10 minutes a day and more over time, and eventually lost 7% of her body weight over 12 months. Her liver test normalized, and her liver stiffness score improved. This transformation didn't come from a diet sheet. It came from aligning with her motivation. Motivational interviewing doesn't require a 45-minute visit. It's a way of communicating that can be integrated into any clinical encounter. Even just using these 3 strategies can make a difference. Number 1, Ask open-ended questions. What changes have you been thinking about? Number 2, reflect and affirm. You've been dealing with a lot, and it's impressive that you're even thinking about change. Number 3, elicit change talk. What might be the benefit if you're able to eat differently? If you're short on time, focus on evoking rather than educating. A patient who says, I want to start walking again, is more likely to follow through than one hears, you should walk 30 minutes a day. To wrap up, managing MASLD is not just about giving patients the right information. It's about activating their own motivation for change. Motivational interviewing is a skill every provider can learn, and it's especially powerful in conditions like MASLD, where healthy lifestyle is the primary treatment. As APPs, we're in a unique position to model and teach this approach. When patients feel heard, empowered, and guided, they don't just change their behavior, they change their outcomes. Thank you for listening. Feel free to reach out to us if you have any question about this topic. Bye.